being in and out of emergency rooms and hospitals to having not one single hospitalization or emergency room visit since he got this. And what's revolutionary about it is the very low price point compared to the traditional continuous glucose monitors, which should make it part of your ROI equation to look at. Because if you have those patients that are going in and out of the hospital all the time, it's apparently, she says it's so easy to use, but John Overtveit, the quality improvement leader for the Karolinska Institute in Sweden, who was with us that day when she presented, he went ahead and got one, and he's a brilliant man. He said it's not quite as easy as the head of USC Diabetes makes it sound, but I just want to say that we're at a moment of a real inflection point for diabetic patients and for understanding how to better manage blood sugar. Yes, Joan?
I just wanted to add to that something that I think is very serious as long as I've been doing diabetes. But with the continuous glucose monitor, we're at a crux right now, and you need to talk to your politicians. It's coming up for a signature. I was invited to the governor's office 10 days ago to discuss this. The incident that we're dealing with now is that kids who have diabetes are covered by CCS until they term out when they're 18. Medi-Cal won't, and then they go off and they don't have their parents' insurance, and Medi-Cal's not picking up the glucose monitor for them, the continuous glucose monitoring. And we took this beautiful, beautiful 17-year-old girl wearing her, she's just got some sort of a princess title. She wore her crown and everything. And she has a continuous glucose monitor. She's turning 18. She turns off a CCS. And even though college kids are being picked up on parents' insurance, you know, you can be on your insurance now for until they're 20-something, there's still this glitch, and she's having to give up her continuous glucose monitor. So I think it's important for those of us dealing in diabetes that we stay abreast of this kind of stuff, because this is this girl's life. I mean, she's had no complications.
So I can tell you that this man's health care costs have plummeted since he stopped going in and out of the hospital. And I mean, he probably would have avoided a kidney transplant. Talk about expensive, right?
Unfortunately, you try to use that logical reasoning and you get the deer in the headlight look. You know, people just don't put the two together. When they talk about saving money, they'll cut something out totally, but they don't look at the savings on the other end. It's all nature. But that's just tagging on to what you're saying. It's significant, very significant.
Well, I'm very glad that you went to the governor's office to talk about it, because we have Richard Figueroa in the governor's office who's very, very sophisticated on these issues. And it'll be a new day with him helping to lead there. So this is something that is clearly cost-saving and life-saving.
And complications. A young girl, I mean, if you give the worst scenario the money that it's going to cost over her lifetime.
So other than saying that we're going to have a wonderful program here on September 9th, that Dr. Wanacott will be leading with Kaiser physicians in physiology and cardiology, I also want to say that on Monday, November 18th, we'll have the head of cardiovascular disease for the CDC here with us, and very likely have the leaders of the Blue Zones program with us as well. So it's going to be a very exciting day, so please ink that especially on your calendar. We're looking at probably doing 10:30 to 3:30 that day with check-in at 10. But I know a lot of the physicians like to arrive very, very early. So really, the Sierra Health Foundation staff does not get here till 9 a.m. They need time to set up. So we really don't want people to check in before 10. Although we have a lot of eager folks to learn quality improvement and get the best seats and so on. 10 to 3:30 with a reception following here, November 18th. So that's going to be super, super exciting. And I just want to say thank you for all the hard work you've done to put this program together. And we're looking forward to hearing back from you when you've been able to implement the continuous glucose monitoring portion now that the technology has advanced so much. Because really from an HMO model standpoint, the ROI is really quite different today with the technology improving. So with that, thank you everybody, and we'll see you back here on September 9th.